It is acceptable.
I'm stepping in. Okay. How many presentations?
One, I think Milongo, who is not yet there, is supposed to come in at some point.
Then we can start and then take the questions towards the end.
Yeah. Okay. So thank you very much, everybody, for coming. This presentation we thought about making this presentation because of the announcement by Adiel that he would like myself and Milongo and the team that he had set up earlier to work on developing a regional strategy on monitoring, evaluation and learning, monitoring, learning and evaluation. I will use those interchangeably, so forgive me if I do the other way. So this was the team that worked on the task force. Adiel then looked at the strategy. He has been keen to have something going that will help him understand how to learn what is going on in the region as a region and learn from the different programs. And so that strategy was finalized towards the end of last year, and eventually he decided to implement it with the authority from the headquarters and asked us, therefore, to coordinate that. So Mulongo and I have the primary responsibility, but really this is a shared responsibility of this team that now is no longer task force, but sort of implementation team that will be working alongside with Mulongo and myself. So we thought about saying what it is about the strategy, because I'm very sure many people have listened to bits and pieces of this strategy or listened to presentations on and off, or along the way we got feedback. But now we thought about coming back to say what it is we are getting into and what is going to change. And those are the two things that I would like to talk about today. We had, as part of us, Sarah, and we hope that Neta, you will fill this role because we really need somebody who will pass around the information, and you'll see some slides in this presentation that really relates to what your work is in the region. So we are very much hoping that you will step into this role because Sarah was doing this role as a regional communications specialist, which is you are now your docket, right?
No, I think we're confused.
Vivian.
Yeah.
It's Vivian. But also I think Yaneta also has some responsibility to come into that. Sorry, yeah, you're right, it is Vivian. So just by way of introduction, if you read the first page, the first pages of the strategy, we have these kind of statements there. That looking at the CIP strategic corporate plan, it acknowledges that CIP is no longer just paying attention to mainly science, basic science, or research, but also in development, so getting involved more in delivery. And that extends the mandate of CIP beyond just research to getting involved in the delivery and in upstream in the impact pathway. And then there is the very strong need to track what is going on, looking back and seeing how far we have come. And this is all a very new territory for most of the people. I think we are morphing as donors are causing us to change the way we do our work. And so there is really very important need to track and evaluate performance in ways that we are not quite familiar with or have not been doing before. And to do so rigorously enough that our evidence is not called to question. And and you also are aware that specifically in Sub-Saharan Africa, we have all these programs. We have 4 programs in Sub-Saharan Africa. Under these programs, we have several projects. These programs are on the wall here. Under them, we have very many projects. But what strikes you when you look at the M&E components in these projects and in these programs is that people are doing what they feel they can do better. So there is really no coordination of how M&E is done. There's no coordination of how monitoring is done, how evaluation is done. More or less like the Bible says, people did what they saw fit in their eyes. This is what has been going on. And for a regional, for a country manager, if you think of a country manager or you think of a regional country manager that needs to be reporting on progress, or a regional director that needs to be reporting on progress for the region, it becomes really very complicated to do that. I will talk about that a little more in the next in other slides coming soon. So the regional director therefore felt that there is need for an overarching strategy that explains how monitoring should be done as a region, how evaluation ought to be done also as a region, and the need to measure performance at regional level, country and then regional level also, and how to aggregate measurements both at regional. Remember, in the country there are several projects probably all working towards sometimes not very really very common end, but there is a common goal: improving livelihood, for example, making households better off, for example. So for the country manager, he wants to answer the question, so have our projects really contributed to this thing we are calling common good for the beneficiary? We also, then there was the feeling that there need to standardize methods of capturing information. As I said, people were doing things differently, and I think that is where the feeling was by the director that really, for going forward, things need to be done in a more coordinated way, using standard protocols and standard procedures that will enable the region to learn from all the activities put together, projects put together, and then to standardize the way we measure things, especially how we measure impact and how we measure the effects caused by the projects. So really going further into this, I would just like to give you some examples from some of the work I have done with some other projects and some programs here in CIP. One time I was asked to put together a report that would compare improvement in income over different countries. This was one of the things. How has income improved? We wanted to start with production. So did production increase? And what is the value of that production? Did sales increase? And what was the value of those sales? And then is there a change in gross margins? And are there households that are, is the percentage of households that are selling the produce that we promote here increased? And when I looked at reports from different projects within that program alone, this was a table I was supposed to complete with projects A up to F, which were known projects that had been completed by CIP in Sub-Saharan Africa, and we could not complete any of those cells at all. Meaning it was difficult to find from a report by the same project that has a baseline and an end line data that could fill those cells. And the same with the production. And even when we called for data to come for us to analyze that data by ourselves and fill those cells, it became extremely difficult because we were getting very, very interesting numbers that are unreportable. The same thing with sales. The only case was for one project in one country where we had, this was a whole table with several projects, and these are different countries. We were only able, from the report submitted to us, fill one cell in all those projects. And that's how tough it can be. Imagine a country manager is asked to provide information on how sales have improved for X. And after looking at all the reports available, all that the manager can do is complete one cell, and only for one study, the end line. So those, and then for nutrition also, we were to do the same for nutrition, and we found out that the measures of nutrition were so differently presented in the reports. Some were measuring, presenting percentage scores, and others presenting actual scores, and so it is hard to compare the percent with actual unless you have data and go back to compute one of them. So scores were also measured for different food groups. I'll show you the food groups we're talking about. Different justifications were given. Some organizations wanted it that way, so everybody was doing what they felt was right, in other words. And then in some countries, the report, countries just reported things as percentages and not as actual numbers. So look at this. I think most of you will be familiar with this. These are the number of food groups provided. Ideally, this is what should be informing how we analyze. But if you look again here, we had scores that took only 7, sometimes 9, sometimes 12. And they all were presented that way. And so if you have somebody computing a dietary diversity score using 7 food groups and another one 9, those are not comparable at all. That's part of the reason those cells could not be completed. Definition also of what we mean by a beneficiary was a challenge. People understood beneficiaries differently. And so people were definitely measuring different things. Okay? This is a case where the benefit is fine, but we have a similar thing. For example, in Tanzania, of course, there was a time when Rogers was distributing potato tubers to farmers, and Rogers is listening. So if Rogers was going out to measure beneficiary, an indirect beneficiary, was that the same person, same definition as what our colleagues in Rwanda are measuring, and for the different crop? We found out that that's really not the case. And sometimes data was captured. A beneficiary would be defined as a wife and a husband separately, others as a household, which combines both. And then in estimating beneficiaries, you know, there are 2 major programs here that are doing both that are also involved in delivery as well as research, SO1 and SO3. In their business plans, of course, they talk about the fact that they are going to reach specific numbers, and then a lot more of those numbers are actually supposed to be reached indirectly. But at this point, we have promised we will reach those indirect beneficiaries. What is becoming apparent now is that donors are starting to ask for the reporting of those indirect beneficiaries. And yet, up to this point, we really still do not have any coherent way of measuring indirect or capturing the indirect beneficiaries, estimating what they are. Again, on the exercise that I was doing for one of our programs here of trying to generate an annual report, I found out that people had different formulas for computing estimating the indirect beneficiaries. And that's beyond even CIP. And if you have one donor that is receiving a report from A and B and starting to ask questions, so organization X gave me indirect beneficiaries estimated using this formula. What did you use? As a region, we really do not have an answer to that right now. So again, as a country manager who wants to be answering such a question to a donor or a program leader or a regional leader, you have a problem if this is what is happening. So I've talked a lot about what informed all this. There was really a genuine reason and a credible reason to do things differently in the region. So the regional strategy was therefore intended to formulate regional performance and progress indicators that are common across programs and at regional level. That's the way we can measure how far we have gone. We got to have an indicator. That indicator should aggregate outcomes from different. So it should be broad enough to be able to say, okay, we have helped X number of people move out of poverty, however we define that poverty. And then based on that definition, to be able to be tracking whether we actually did the X or we are short of reaching that X. And then the second was to standardize the measurement and reporting of progress towards the targets. Okay, so I hope Mulongo will join this meeting later on, but Mulongo has been fond of using the word ticking the boxes, meaning you are providing what you have done. But ideally here, standardizing measurement is that we have a common way of measuring things. That was the thing, so the yardstick is the same. And also that we have a way of tracking progress. We have achieved this and as we move along. Monitoring and to monitor and ensure accountability, especially with data quality, because the way at the moment the way data is managed by some projects, and even some by some projects is risky. If we were to have a data audit, we would score very low, very poorly as a region. So this is one of the areas that was felt. It was felt that there is really need, and we have the objective to really zoom into, or rather to focus on how we manage the quality of data and whether we can stand by our data and say that this data is credible and genuine. And that, so this speaks to what in monitoring is called data quality assurance. Can we assure ourselves and also the people who ask for data that we generate and that we store, that our data is credible? And then to strengthen the design and implementation of project evaluation and effects. And lastly, coordinate management, use, and sharing of knowledge. And this is where Vivian's role comes in. And this is also where I think we will depend a lot on Yaneta and Luca to help us with this. So, in a way, what therefore we are planning to do, starting to speak about what we want to do, is to be able to strengthen the way we do monitoring in the region, as well as the way we do evaluation. This is really where we want to go. Told you about the challenges we have, and we still continue to have. And so the first thing, the thing we really are formed to, the reason we have been constituted as a unit or as to implement this strategy is to be able to strengthen the way we do monitoring, and I will unpack that a little more, and also do evaluation. So, and in monitoring, we want to be able to measure how far we have come from the baseline. Again, using a common yardstick, and whether or not we are on track. And that speaks to monitoring specifically. And then under evaluation, we want to be able to establish causality. Can we really realistically say that we caused the changes? Okay, and how much is that change that we have caused? I got this quote that it is not enough to know where we have where we have reached. We also need to know if we have caused that. And this little cartoon here says changes are 50-50, that it is a total crapshoot, but it could go either way. It's basically saying that you really are unsure whether you caused the change or you did not cause the change. It could be some other organization that caused the change, and yet you say our project brought about an improvement. This is how we conceptualize the way we want to implement this. Our starting point will be in generating regional indicators. Working on indicators that then aggregate upwards to a regional level. Start with project level objectives, and therefore using project level objectives, we have project level indicators, and then these indicators for different projects, of course, contribute to the program, the SO indicators, and then these SO indicators all together contribute to the regional indicators. You can think of it this way in a little more detail. That at the project level, you have several projects that are contributing to an SO, and these projects have indicators. Those indicators, it doesn't need to be all of them, but those indicators of various projects then contribute to program indicators and eventually to regional indicators. Now, I should say that here we know many of the indicators. Projects are implemented based on, they have some goals. Those goals are translated into targets, and targets translated into indicators. So usually, most projects will have some indicators they are tracking. But here, we are not off the woods here, even here, because we have recently, and in many cases, some cases, come across situations where a project team is planning to do, for example, a baseline study. So, Fred, you can imagine a project starting and is going out to do a baseline study but has no M&E plan and no indicator at all. So they are getting out of the door to go and do a baseline study. So you ask, so what are you going to capture in that baseline that you are hoping to track if you don't have any sense of what the indicators are? So one can think that at the lower level here we are fine because projects have indicators. But there's this period when projects are starting off, when the project has been signed and the CIP is still looking for the project manager and the project staff. And the donor is saying, you need to be doing your baseline now. And the project staff comes and he's told, M&D officer is told, look, baseline was overdue. It's overdue by 2 months. So he speaks the questionnaires and wants to go to the field without an M&D plan and indicator. So we are not safe even down here unless there is an oversight on what people are doing. At program level, we have indicators, but at regional level, we don't at the moment. And that's also a place where we need to work. In terms of measurement of progress, we plan to work with what RTB is doing, which is basically to measure progress or performance along the impact pathway. So starting with inputs, activities, and outputs. These are process monitoring. So what is going on at those levels, and then outcome monitoring, and eventually impact at the top end. Sorry, you can't see that, but that's basically saying measuring impact. So the strategy envisages, or is, we are going to work along the whole impact pathway and not just at one point. In evaluating performance, there are broadly 2 known methods of evaluating performance of a project, and we intend to use both of these things, or to support both of these broad methods, the qualitative methods as well as the quantitative methods. we are quite, as an organization, CIP, we have quite a number of people who are capable of handling qualitative methods, quantitative methods, but quite few that can handle qualitative methods. So the importance of this is that these methods complement one another. The quantitative methods are supposed to answer the question, what questions in any endeavor. So what caused what, the cause and effect. And the qualitative methods explain the changes that are observed. So they ideally complement one another. But we, as CIP, we are, as I've just said, very weak in qualitative analysis. And most of the time when you talk qualitative, people think you are talking about focus group discussion, key informant interviews, observations in the village, and that this is really not very useful data and cannot be published. And that's not really correct. You can publish using qualitative studies. In fact, it is all about using systematic. If you can use systematic case studies approaches, you can publish and you can make a lot of help a lot the projects and the programs understand really what is going on in the project and on the programs and in the region. And to not really learn how to do a good job in qualitative methods, in our view, makes us miss out on some of the stories that around the work we do, and also stories around the changes we may be causing out. So our goal as a unit is to help see that we have strengthened the capacity to use some of the qualitative methods, like case study approaches, the systematic case study analysis, to do a better job at understanding what we are doing as an organization. In terms of quantitative evaluation, we plan to we basically are drawing from the methods that are outlined in the RTB Foresight and Impact Assessment Cluster, which is under Flagship 5. This flagship is still has issues, and I think you know about that, Flagship 5. But nonetheless, this is where we are drawing from. The thing is, this cluster actually defines all the broad ways of measuring impact assessment. The ex-ante impact assessment, the ex-post impact assessment, and the foresight, looking horizon scanning, if you like. I think there was at some point it was called horizon scanning. And so our aim is to prioritize, our priority is to coordinate how these different methods are used. Specifically, coordinate how surveys are done, in the region, and also pay attention to how different types of surveys are done. I got this cartoon here that I think explains a lot of what I see around it. When we have a project and we are supposed to be going out to do a survey, this is about a baseline. We ask these kind of questions. And the reason why we need to be doing baseline is somehow completely or sometimes removed from us, and could be just a lone voice calling, as you would, if I may say, calling in the wilderness, that there is some gain to doing good baseline study. But then the questions that the team would be asking, look at the color, they are different. So it tells you there's a lone voice, they're saying, go out and do baseline study, there are benefits to it. But others are asking, how do we do it really? And why should we really be doing it after all? I have had these questions asked. And who will do it? So not uncommon in CIP among us. And so this is one of the things we really want not just baseline, but also midline studies for those projects that will do them, and also endline studies for the projects that will do them, or that are planning to do them within the region or within the country, supporting the country managers and also supporting the regional programs. In terms of learning, we really would like to see a lot more coordination in the way knowledge products are stored and used for learning. At this point, when we were preparing the strategy, and what we learned is that it is sometimes very difficult to just find what has been done in CIP. Okay? And when I joined CIP, I was asked to look for some data sets, for example, of baselines and endlines that were done prior to joining CIP, and I couldn't find those. And some reports, you can't find them. So the idea here is to be able to coordinate the way knowledge is produced and used for learning as a team. These next slides are actually for Godfrey. I don't know whether he's online. Okay. So Godfrey put forward also what he thinks we need to do. So
hello?
Yes.
Okay. So I would like Godfrey to present this next slide. Godfrey, can you present from your end, or you want me to move the slides for you?
Oh, okay, I think you can move them.
Okay. So this
Can you hear me?
is the way forward as conceived by Godfrey. So Godfrey, take over from there. Okay.
All right. Good afternoon, everyone. Hello, Julius. Confirm. Can you hear me?
Yes, we can hear you. Please proceed.
All right. And thanks, Julius, for the background information you have provided. And I think going forward, there are three major areas in the M&E, especially for next year, immediate steps that I propose that we are going to do. The first one is basically to come up with a regional M&E plan. And this M&E plan will consist, all the protocols will be a manual for operationalizing all the process indicators, the one I just mentioned earlier on, as an architecture to guide the process going forward. So I see this is about a 3-month design, which will be consultative to make sure that we have the indicators well defined that cut across the SOs and also in consultation with RTB. And also that plan will have very important the data management and quality protocols of how we are going to submit data, how we are going to manage data, who will be in charge of what, and how to define those specific indicators. So that's what I see in the short term, in the next 3-4 months by April. And once we have agreed upon that framework as an institution, with the program leaders and the project managers, then the most immediate logical activity therefore will be to build their capacities and initiating structures, therefore to operationalize that plan. In other words, we are getting this plan from the legitimacy of the plan from the strategy. So these capacities will basically involve identifying key M&E focal persons in each country, working with the country managers, who will be in charge of some of the items that will be itemized in the regional M&E plan. Those will be in charge of data management protocols and submission and data cleaning and all that. And of course, that then takes us to the next step, which will be agreeing on the monitoring tools for the indicators we'll have agreed upon in the first step, and then designing an online data submission system, which I'm calling the regional performance dashboard for those regional indicators, which Julius, you mentioned at the beginning, and also agreeing on the data quality assessment. Who will be in charge of that, and at what point we'll be doing that. And then at the end of the year, I propose that having done the first two important steps, we'll sit back and review our system. That's by December, asking, did we achieve what we achieved? Where did we go wrong? And what can we change? So that's what I see in the next 1 year, operationalizing the process monitoring aspect of the strategy.
Okay, thank you very much, Godfrey. So, how exactly do you want to achieve this? This is what we have in mind to use. Basically, what we are having now is a unit sort of that will, it's a kind of a unit that will bring together or bring to the table skills that we are going to be harnessing from colleagues and individuals within CIP to be able to coordinate and structure the way we do monitoring and evaluation as a region. We want to get skills from gender and I say that because we are just and we have Nisai who contributed to the development of the strategy, and we trust that she will continue to participate in this, bringing in some help in terms of gender that the region needs. Communications and knowledge management, we have Luca, we have Dianetta, and then we have Vivian, that we will tap their skills. Monitoring and evaluation, we have all our colleagues who are out there. Some of them are extremely good in what they are doing. And those are the people we will call upon to help, even mentor one another in cases where we need. But we also have some of our colleagues who are very good in evaluation. As I mentioned, we are strong in quantitatives as CIP, have been quite weak in qualitative, but we will use the resources we have here, tapping from those resources, documentation and management, and then monitoring. And so we, as a unit, our goal is to bring all these different skills. At this time, CIP does not have the resources to employ all these expertise. So it will be a sort of borrowing resources here and there for Godfrey and I, calling on colleagues. So for instance, if a country or a project has some challenge with gender, I will request Nisai to help. If a project has a problem developing M&E plan, Longo can pick on somebody who is very good at that to help that. We will also draw from the resources we have within the community of practice, the M&E community of practice, to support some of these things. And that's what we conceptualize, that's what we want to do in terms of operationalizing the implementation of the strategy. So if we have a challenge with drawing some indicators that relate to nutrition, we will call Fred or Robert or call Tawanda, nutrition and food science. Please, can you help us figure out how this happens? For now, CIP cannot staff that unit. That unit is a unit that now, when finally it gets funding from Lima, will for some time constitute basically 2 people working part-time. And that will be Longo and I, but drawing from different people. So the unit is to ensure that the M&E is well planned and executed, that it serves as an internal, it has an internal team, not going out to get consultants to do things. I think for now, we can learn from what people are doing, but we'll keep to ourselves internally, coordinate the evaluation processes, decide on the scope of some of the exercises, evaluation exercises, support project and country managers to develop how the terms of reference for doing evaluation whenever they want to do this, support the selection of evaluation team, work with project management teams to get the best out of evaluation with the when they consult out evaluation. But one other important responsibility we see of the unit is the responsibility of being part of the grant writing, so that the structure of M&E and the design of M&E is well thought out at the time of writing these grants and these proposals, rather than waiting later on and starting on a clean sheet and realizing that we didn't think enough, and the donor, we promised too much and didn't think enough of how we deliver it, as sometimes happens. So in a summary, the unit will assemble relevant, committed, and skilled people, skills from different staff, and build or strengthen the capacity of our staff working in M&E to design and implement a good M&E, effective M&E system. Design and implement good evaluations, and also in the management of knowledge, and also in shared learning. I think that's what I want to say for now. So I'll end it there, and then we can have some discussion around this.
I think you can take questions from there, and then we can move on to our colleagues who are on.
Yes.
Yeah, quick question. As you know, we work with other partners. Excuse me. We work with other partners in wherever we are. So, of course, in the CG system, if you take countries like, let's take Tanzania, there's so many CG centers out there that we as CIP will work with them. Okay. If you even consider like the other projects like the activities and all that. Was there any consultation with some of those CG centers to see if we have a common indicators in all the areas that we're looking at, for economy, nutrition, the systems and all that? That when there is a collaboration with them, we don't have what we call a duplication of effort in terms of indicators that we have already. Was there any consultation with them, or what was the process? Did we do this as CIP alone? Did we look at what AGRA has or whoever has, so that we have a common understanding, so that when we're having a collaboration with them, we don't argue about which indicators to use. We have this as CIP. You have this as IITA. Which one do we have to settle on? So we need to have a...
Yeah. Okay. We answer one at a time.
I think so.
Okay. Okay. I will ask Longo to respond to that. Godfrey, are you still there? Is he still online? Yeah. Okay, so maybe steps out. So the process of developing the strategy, we haven't got to the step of developing regional indicators at this time, as I mentioned. What we have with us is the indicators that are at program level, and what we have also are the indicators that are in the ACP, the Strategic Corporate Plan. Those are what we have. What we did in developing this strategy was, what is it we should do, and how do we need to do it? And this is why you're hearing Godfrey saying the first step going forward is the indicators, regional indicators that are working. We get the indicators of the region that will be fed into by what the projects contribute to the programs and programs then to the region. And of course, they should be in line with our strategy of organization. So, and this is unfair. I remember also not long ago, I asking the same question about other organizations. And in fact, when you look at that impact pathway, there are several things where we look back as an organization and say, this is our indicator of tracking. For example, think of value addition. What indicator are we tracking in value addition? Is it the number of products we sell to Turkey? And is that across all the countries? We don't really have specific, well-defined things that are common. Leave alone going out to our collaborators and partners. So that's our starting point, really. Yeah.
Before I ask my questions, I want to comment on this point raised by Fred. It's a very important topic. I was attending together with the P5 planning meeting last week in Nigeria. So you didn't manage to make it. As you know, it is the first cluster of that flagship is forest site and impact assessment. So what came out of this cluster group discussions, they agreed that the issue of indicators is going to be the top priority for the next 3 years for all the partners, all institution centers to have the same language around the indicators. This is already. I think it's better you make a follow-up with the team and find out what's going on. So my three questions is the M&E units you are talking about. It's not really clear in my mind. Going to be a project-based, program-based, country-based, because if you keep really having the people who are like project-based, that's not going to be really a unit. For me, I was expecting really regional units, or program units, country units, or M&E, whereby they get requests from different projects and they organize themselves to support them. And when they really have too much demand, they outsource consultants to support them, but still working as a unit for the program or the region. Otherwise, this is as usual, having the M&E for each project, different types of indicators, there's no way to grow, So the second point is bring again the chart, this diagram was a bit confusing where you have a tackle for this communications and knowledge management as a different thing compared to documentation and data management. So for me, the two are one. I don't see what you think of knowledge management without data management, without documentation. So I don't know why you have four. This is the second point. The third point is the tricky one, impact assessment. I've really been seeing people assessing the impacts and using the project resource. Is that really impact? Because the ex-post impact assessment, that means the project ended already. The bus had been terminated. So that's you at the same time. 1 year or 2 years after the end of the project, you assess what you have been doing, what is the impact. But what I'm seeing with the different partners, including CIP, using project resources and assessing the impact. Is that impact or just monitoring? So those are the few comments I have.
Okay. Okay, good. Let me start with the impact assessment. You are right, Jordan. Impact is a long-term aspect. And if you look at this impact pathway, you see where it lies. Very high up. It's all the way up here. It's something that, sorry, here. Something that we really are not doing during the life of the project. But still, CIP has projects such as Mama Sasha, for example, ended now, is it 1.5 years? And
2 years.
2 years now. And CIP would be interested, for example, at some time X, 3 years later, to look back and see how much of all that knowledge and effort has disseminated or has been retained by the communities in terms of using OFSP or in terms of caring for young children and stuff like that. Then that is a typical impact. It can be done by CIP, but after the project. Right. It can be done by independent consultant. Who should be able to do that? That should be part of what this unit will support. Ex post. But as I was outlining in the bullets, part of what I see, if it is an external consultant, is who are we getting? Are we getting the right persons that have right skills to really be able to assess this? For example, it's wrong to get an engineer to assess the impact of nutrition projects such as Mama Sasha. However, unless they have a lot of experience with that. So these are some of the things that we plan to be doing as a unit. When you are looking at what changes are happening in the life of the project, you are actually assessing effects. You can capture outcomes that are coming up, and that is commonly done. You can do that using different study periods to look at what changes are happening. Those are outcome indicators, using some well-defined outcome indicators. Yeah, but I agree with you that this term impact assessment can sometimes be loosely used by people and can be uninformative. In terms of M&E unit, whether it is project-based or region-based or project-based or program-based or region-based, and how effective it will be under the circumstances in which the unit is now set up, is a good question, Jordan. If you look at the strategy, we have a very short but very, what I consider very strong section towards the end, how to implement the strategy. And we recommended that in the strategy, we recommended that it is good to have the unit to have some level of independence and to serve as a service unit, as you are describing it. A service unit in the sense that it will be a unit called upon to provide the impact evaluation, impact assessment services, to provide monitoring services such as the design or overseeing design of M&E plans based on the project or on the organization. For example, demands of USAID are quite different from the demands of DFID and from the demands of Irish Aid and from the demands of GIZ. So providing services as required. Is there one particular person that has all that knowledge? No. But actually we have very many people within CIP that are very smart in those areas, as we learned very recently also, that we can draw upon as a unit to provide that. When we were developing this strategy, one thing that we learned is that in many organizations, impact assessment and a unit such as what we are describing here is, like most of the cases, independent. so that they are not under the influence of the people supporting. Okay, and that's important, an important issue that we raised and is documented in the strategy. Let me tell you what happens with other organizations, because during the writing of this strategy, we did look around to see what other organizations are doing. The most CG centers that are very successful, they call it socioeconomic sections or departments or divisions, actually operate as a service unit. Basically what we conceive here. But they are not under a project and they are not under a program. They are supported by the organization straight. Some kind of taxation, like a value-added tax that goes towards this unit. So a certain percent of what the projects get goes towards a kitty that supports this unit. And so when the project needs to be doing baseline, it doesn't need to worry about who is going to do the baseline. It just calls this unit to come and provide that service. About these charts, I agree with you. That is something we can organize. The idea here was that we have different skill sets or concentrations of skill sets that we foresee as being essential in implementing and operationalizing the unit. And that needs to be a combination of skills that are, so in the generation of knowledge, we are talking about people who can do monitoring and evaluation to really be able to capture what is going on and answer the question how and why. People who are skilled in evaluation to be able to answer the question what caused what. And so we're talking, and in knowledge sharing, we need people who can package that knowledge. One thing I have learned in CIP is, I learned recently in CIP that I know how to write, but I don't know how to communicate. Because anytime I wrote something, for example, and sent it to Christine, and I thought it was good, the product looked better and different. And that is the kind of thing we want to tap on. We can generate the knowledge, but then have it packaged in a way that somebody passing a paper will pick it up because of the way it looks, just to see what is in the paper. Yeah.
We can take 2 questions from our colleagues who are online. I don't know if there is anyone with a question. I can see a number of people online. We have Bruce. Bruce, do you have a question? Bruce, are you there?
Hello.
Hi, Bruce.
Hello.
Do you have any questions for Julius and Godfrey? Bruce, are you there?
Hello.
Hello.
Hello. I'm Paul. Can you hear me?
Oh, this is Paul. Yes, Paul, we can hear you. Please proceed.
Yes. Yes, thank you very much. Thank you, Jaros, for the presentation. The way I see the M&E unit is at the regional level, I see a coordination or support unit that will be organized and to be able to have some baseline format, midterm, and then endline studies. Yeah. And so if we call it a M&E coordination or support unit, I see it supporting all countries. At this level, I see M&E officer base, and so far we have established entry-level M&E units due to the time difference in the beginning of projects, and also the fact that all staffs are linked to projects. I mean, M&E staff. I will see it more sustainable to have at the regional level a coordination, M&E coordination or support unit that will be backstopping and supporting all the M&E work in order to harmonize the methodology and the type of result that we want to collect. It's just a comment and contribution. Thank you.
I had very little. Thank you very much. Paul, your line was rather difficult it was rather difficult to follow you because of your line, but just to respond to what you are saying, it is indeed.
Hello?
Can you hear us, Paul?
So the point from Paul was that he was supporting institutional M&E.
It was a comment saying that having a regional support coordination M&E would really help country to harmonize the M&E baseline and endline survey that we conduct in order to get the type of result and quality we want.
Yeah, indeed. Let me just mention
Thank you.
Godfrey, I wanted to mention what Godfrey said a short while ago, that he is considering having some country focal persons, that appointing some country focal persons that will act as our entry points as a unit into that country. They may be project-based, but we look for somebody that we feel is very good and capable and can mentor others or help others, because we are not going to be everywhere at the same time. As Dieudonné is saying, we still are, our salaries are still being paid by projects, so we still have to contribute to the project. But the goal is having that person in country. It's a good thing, because then we can work with the person to organize, to coordinate the way things are done in the country. We're thinking of a case such as, this concept of focal points. It's something we have been doing as an organization with other projects and other programs we work with, and that's the kind of thing that Godfrey has in mind. That if we go into Kenya and we find that Luca is quite familiar with the kind of things we are interested in getting done, Luca can help the others, and we can just be supporting Luca to do that at country level.
Let's take another question from our online colleagues. I can see Rachel, Rogers, Cindy, Srini. Anyone else with a question?
For me, it's not a question. I don't know whether I can give a comment out of the question which was asked, or comment which was given by Dieudonné and friend.
Sure, go ahead, Kirimi.
My comment, I know friend talked about whether there was any communication with other organizations and how then we can coordinate. I would say this is a very commendable thing, and I think that is the direction the CG centers are going. We'll need to appreciate how difficult it is within, leave alone within CIP itself. It is very difficult even to get an agreement within the SOs themselves. So I think that the best way to look at such a unit or such an effort is to figure it out, how to get our house also in order in the first place. How do we get things done well? And then if we are coordinating and cooperating with others, then it's possible for us to say, yes, our house is in order and we are getting some work done. And let's figure out how then we can ensure that we get all the things which can be done for everybody. And that is, at that level, I think that is where the RTB is coming into the spot there, because I think there is a coordination between what is being done there and then the RTB unit led by Claudio, the consultant. But I think we need to agree that it is not one of the easiest things even to agree among people. And you can also see even where the ordinance says, first of all, he has even issues about what we call impact and all that. And it is because we need, first of all, to get to that level where we know that we can go to somebody or we can go to a unit which can assist us think through some things we are talking about. And then once we agree with them, then we can move on. But I think going wider than that at the beginning, except because we have to report to RTB, we need to be aligned to RTB reporting, I think it will be extremely difficult even to agree with other people. I think that's my comment.
Thank you, Kirimi. That's indeed true, even within the project itself.
Yeah. Let's take one more comment or question. Yes.
Hello?
Yes, Reni.
Yeah, I'm Rogers.
Rogers, okay.
From Tanzania. I've got maybe 2 comments or questions. The other put across saying that we do end-line study using project funds, and sometimes you may not even get intermediate outcomes even when a project is something like 3 years. You're just beginning to see things happen and then you close. Now, how is the ME and L unit going to capture real outcomes and real impact that can be attributed to project efforts? And therefore, will M&E raise funds or get funds from CIP to make sure that when the project closes, maybe in the next 1 year or 2 years, the M&E unit is able to come and capture real impact? The second question is, I was asked by saying reports, most reports for baseline and end line, you could not test them, and there are a lot of blanks on different projects from different countries. Usually, when we make reports, we submit them to Lima, then Lima sanctions them for distribution. So, what happens to those reports once they have been distributed to partners here? What happens to those which are supposed to be in Lima? I have a feeling that there should be a repository where those reports would be found, and then we would be able to know exactly what's happened, and one could easily refer to them. And I hope if that's not the case, the new ME and L units should have a receptor so that once the reports are done for the different projects, they open a kind of a doc for that project, and all the reports are put there so that in case somebody wants to refer to them, then he's able to get those reports very, very easily. The final one is on the structure of M&E units. I think I had some time and I reviewed the document which was circulated by Julius. Thank you very much. However, that Venn diagram to me, I think it's a kind of an interaction map than a structure. Because I would expect a structure to have some reporting line, some line of command or something like that. So to me, what you present as structure could probably be improved to a kind of interaction map, and then we get a real structure showing reporting lines and lines of command. Thank you very much.
That's true. Thank you very much, Rogers. I like that the last sentence, having a good, some kind of an organogram showing reporting structures where Rogers is supposed to report to X and X reports to Y. We are not there yet. What I can say, Rogers, about the funds, where will the funds come from for doing impact assessment? This is a good question, and if you read the strategy towards the end, we anticipate that with time we will be able to wean ourselves from reliance on project level funds or from CIP level funds and be able to attract funds for conducting impact assessment. There are a number of CG centers with very good socioeconomic units that are able to get this kind of funds and conduct even complex studies such as randomized control trials and so on. So, but when you think about it, Rogers, how to get there and to get to the level where you earn the confidence of the donors to be able to support a unit like that will depend on how the donors see the capacity of that unit to be able to conduct the kind of work they are to support. So it's going to be some sort of chicken and egg thing. It is the responsibility of CIP really to be able to build this unit to the level that it has the confidence of donors to put their money in for evaluations. But this is something we anticipated, we documented it in the strategy, and we want to work towards that. For now, it will have to be, if we want to do some assessment of what we have, funds will come from CIP or from projects if we want to look at some performance regarding outcomes and or effects of a project. That's how we see this working. About repository for knowledge and why the cells were blank, you're right that the cells ought not to be blank if there are reports that were done. The problem is that the reporting, the information reported sometimes could not allow us to, yes, we did get reports, Rogers, but they could not actually help us to fill those cells. And we went even back to the data and still were unable to fill the cells. It is about the question you want to answer given the report or given the data. That is where the challenge is. And then moving forward with the repository, I agree with you and I support the idea of a repository or an archiving sort of system where we can track institutional knowledge over the time. Right now, when you want a document, it is not always easy to lay your hands in because you don't know. There's no system that can do that. Maybe you go to the library. But in the region here, if you want to look for a document, it can be sometimes very difficult. So this is one of the things that LOCA and the communications group and knowledge management team that will support this unit will help us put together a system where we can look back and find knowledge easily when we want to use it to inform future decisions.
I think we've already started with the open access,
right?
With data and synergies.
Yeah. Yeah. Good.
Hello.
Yes. Go ahead.
Hello?
Hello?
Can I go ahead, please?
Yeah,
okay.
You can go ahead.
Yeah. Hello, everyone. This is David from Nigeria, the Hermany officer for the Physics project in Nigeria. In just one line, it's all about creating a cassava seed system that is self-sustaining. And of course, as the sustainability is a key word, even post this project intervention. First of all, I want to say thank you for bringing me on board. I feel like I'm part of the family because I feel all the while that I feel I've been working in isolation. Okay, thank you very much for these great presentations. I just have one or two comments and then some questions. The comment basically has to do with the need for us to bring in a communication expert to help us fine-tune our reports and information that we've gotten from some of these projects, some of these program implementations we have here and there, so that we can communicate effectively back to stakeholders, to funders, to people who has one or two things to do with these projects we are implementing in our various locations. it takes an extra capacity building for an M&A person to build their communication or report writing skill so that they can effectively communicate results to those who need to hear them. More often than not, we go to some of these people, farmers, stakeholders, and we get information from them. And we use this information for at our own, to carry out our own activities, but we don't go back to communicate the results of this data or information gotten from them. So with Vivian, I think I remember Vivian and other communication people you're bringing on board to help us fine-tune this report. It's going to help us a lot better in communicating results. The other thing that I actually want to talk about has to do with need for sending information or data that can be used at the regional level. What am I trying to say? We have several projects and programs running concurrently at the moment in different locations. But to realize that each project here, we have M&E officers or specialists or people who are project-based. We develop indicators unilaterally or in isolation, and then when we ask to send in our report, to send in reports, we've forgotten that all these activities were done not putting in mind that when we send this result or this report up to the next level, how do they aggregate this different information? So I think first thing that is very important is for us to create maybe an indicator book. At the moment, I'm part of a team in IITA. But I was with IITA with Jimmy Tropics program before I moved to basics with CIP. I'm part of a team that were developing an indicator book for IITA. Looking at sustainable land use, poverty, and also looking at yield. But at the lower level, we have several indicators. We define them, and everybody understands that adoption means this, or this means this. So when you have a project that is starting up in a location, I need to develop a set of indicators. What you need to do is look back and see if the pool of indicator from the indicator book, if you have any indicator that speaks to your project or that speaks to what you intend to achieve, or you don't need to develop a new set of indicators. Just go back, pick them from the pool, and key them into your project. So when you're reporting, if I'm reporting from Nigeria and we have somebody else reporting from Kenya, then Tanzania, Uganda, reporting similar indicators at the regional level, it's easy to aggregate. I think we might need to look into this. It's very, very important. And then I also want to say thank you as I look forward to working with this group in subsequent engagement. Thank you very much.
Thank you very much, David. And I want to acknowledge that I received your email with your interest in joining the M&E Monitoring, Learning, and Evaluation Community of Practice. I will request Luca to send out your invite so you join the team. I start from there. Now, you have raised some very interesting points indeed here, David. I hear you when you mention that you have felt since joining CIP that you are working in isolation. And this is something that is not unique to you yourself. I have heard other people also mention that when they joined CIP, all they were given was they were assigned a laptop and a desk. They didn't know what M&E is, what kind of M&E is done in CIP. They didn't know anybody they could ask questions immediately except they knew the manager and the project staff. And this is something that if you saw the slides that the one slide that Godfrey presented, this is one of the things that we want to work on. In the strategy, we actually document and indicate that we want to be involved in the induction of M&E people. We do not, we would like M&E staff when they join, that they get to know what we do, how we do it. They get to know that there is a strategy, And by the time they join, hopefully there will be a framework, a manual, similar to what you are describing for IITA. Not that Mulongo said that one of the goals, the most urgent thing he is going to work on is to develop an M&E manual for the region. We hope that that manual will be in existence, and these guys, our new colleagues that join us, M&E officers, walk away from their signing their contracts with this in their hands, so that they are informed about what they can do, and then that we can link them to, once we operationalize, the focal point in their countries, so that they feel part of the CIP community, but they also have a place where they can, somebody they can ask questions, and they know the places they can reach out for help from. So I really appreciate the fact that you have brought this up. I one time talked to an M&E officer who was leaving. It wasn't an exit interview, but I got to learn about this. And one thing this person said upon leaving is, I have been in CIP for 1 year, I didn't know what I was supposed to be doing. But this was an M&E officer. And this is not good. I mean, when you think about getting your value for money as an organization, I don't think CIP got value for money in that case. And these are some of the things we want to avoid. Your point about communication expert to be able to package material, that is well noted. Your point also about being able to aggregate the outcomes within regions. So I'm thinking of West Africa, for example. We are in Ghana, we are in Nigeria, we are in Burkina Faso, and we are going elsewhere soon. How can we say that this is the change we have caused in West Africa region? That a smaller aspect of how can we say that this is the change we have caused in Sub-Saharan Africa region? So the idea really that we have is that we can help the country managers know how to aggregate progress at the country level. And therefore, that can be done at the regional level, meaning West Africa, East Africa, Southern Africa, and at the broader Sub-Saharan regional level. If we can get that, we'll have helped CIP quite a lot. And we will have helped the managers and the regional director. Managers here are project managers, country managers, program managers, and the regional director, be able to answer in a very short, maybe 1 day or so, a question such as, what change have you caused in your country or region? Without having to spend many days asking people to work individually to get this, which is what we do now.
Thank you very much. I think we have to end because we are past the time.
Just one point.
Yes.
Let's value our time. We've been sitting maybe almost 2 hours. Value our time. Really, what is the way forward? I expect, for example, that we put together a minute from this kind of discussions, this meeting, and circulate. So, because we've been here, it's very expensive to sit here.
Right. And I think this meeting is being recorded, right?
Yes.
Yeah. So that will.
There are a few people who will go through those materials to listen to that.
Yeah.
But at least 1 or 2 pages.
Okay.
Yeah. Just to share with people and just you know.
Yeah. Yeah.
The slides by Julius on the next steps are very, very practical next steps. And maybe later on you can share how exactly that is going to happen.
Okay. Okay. Yeah. Perfect.
Okay. Thank you, everyone.
Thank you very much for this opportunity.
Thanks, Julius.
For joining. Sorry, I never.
Sorry. No, it's okay. Well done, Julius. Thank you.
At one point, you disappeared.
Did you sleep when we off?
Yes, I did. I noticed that.